Osteopathy and craniosacral therapy for babies and adults. Because this case, although it was asked of me by a practitioner about a baby, actually is really relevant for treating adults as well. Honing the zoning. A nice little phrase so that you remember this particular point of teaching that we're going to do in this tutorial. This practitioner was asking about high trauma babies, and in particular babies with alcohol fetal syndrome. And what she was asking was, those babies often say no. In fact, the question was, are there any absolute no's when treating those babies? Because she finds there are often babies that do say no a lot. Now what she means by that is, when she's working with the tissues, the baby is like squirming or crying or kind of saying, no, I'm unhappy, I don't want this. That's a really important aspect when we talk about treating babies with trauma, but also adults with trauma. And I'm going to talk about an adult patient initially. It has a huge bearing to treating babies, but it also really will illustrate what I mean about this zone. What happens with this zone is that all human beings and animals have this zone. It's this physical zone of what we feel comfortable with, but it's more than that. It's a kind of energetic zone as well. It transcends the physical. And the example I'm going to give you is a patient I treated, probably 10, maybe more than 10 years ago. And it was a really difficult case. A shelf had fallen on her. She had a lot of trauma, a lot of emotional trauma as well, and a lot of nervous system charge in the system. And we did a lot of treatment, hands-on treatment, and she responded well. But one particular time, I think it was 4 or 5 times after, 4th or 5th treatment that I was treating her, we finished up, I took her out into the reception room, left her with reception, went back in to do my notes. And then I could hear this kind of stuff going on, so I opened the door, and there was this issue. I don't know what the issue was. She was having some issue with reception over some sort of problem. So I went into the reception room and, what's going on? And she started explaining it to me. And the reception room was quite big in our reception room area there. And she was like a long way away from me. And it was like so far away that I was feeling uncomfortable with that distance, because I'm trying to solve a problem from her. So I wanted to step forward and be not in her face, but close enough that it was an appropriate distance that, we could work together on this problem. And so I stepped forward and she stepped back. And I was like, okay. And so we just chatting away there. And so I thought, okay. And I stepped forward again because I was feeling a little bit uncomfortable with the distance, like I told you. And again, she stepped back. And I was like, okay, right. Well, I don't need to be told, I did need to be told twice on that occasion. Told twice and listened and learned from that. So she doesn't want to be closer than that. So we're continuing with this conversation. But in my back of my mind, I was thinking, okay, well, I'm a little bit intrigued by this because, inside the treatment room for the last half hour or more, I've actually been touching this person. And yet she wants to have, it was a long way. It was probably 5 or 6 feet away from me. I felt like almost shouting, she was that far away. So we had this distance, continued this conversation. And so I stepped back because I wanted to see what was going on. I stepped back, she stepped forward towards me. I stepped forward, she stepped back. And so we had this little dance where we kind of actually went around the treatment room, almost did like a circle as I moved, and she moved, keeping this distance away from me, whilst having this conversation and sorting out what was going on. Now, for me, and this is why I use this point, because for me it was such a graphic illustration. I never forgot that. I said it's over 10 years ago. Such a graphic illustration of that physical zone. Aware, and you'll understand this when I tell you about this, there's a distance that you're comfortable with someone. And maybe if you know them better, you can be closer, and if you don't like them, you want to be further away. But with this patient, why that was so graphic was that only a couple of minutes ago, I was actually touching this person, physical contact. And now yet at this time, a couple of minutes later, she couldn't even handle me being closer than 6 foot away from her. Why? Because the environment had shifted. In the treatment room, she was coming in, she was giving permission, she understood there was a certain element of touch going on there, and so she was happy for me to touch her. Now it was gentle treatment, but it was still touch. Outside in a different environment, even though it's 1 or 2 minutes later and it's the same person, because it's a different thing, it was to do with, I can't remember, it was to do with money or booking or whatever it was, it's a different thing for her, and so her zone has shifted. So it's shifted from physical touch to 6 foot is the distance she's comfortable with in 1 minute. So it's a really graphic illustration of what's going on. So now when we talk about treating patients or treating babies, What we have to think about is that zone, that physical zone, but there's an energetic zone, so it's all blended in. And are we stepping over that zone? Now, when you work with patients, whether you work in a structural way and you're doing kind of quite big movements and, you know, adults and working their joints and things like that, there's still an element of that zone going on, and an element of, like, you might move an arm up like this and it hits a point of apprehension, you know, where it's jamming a little bit. Now, some patients will let you take up and roll with it, you know, if you're forcing it past that point, and other patients will just lock the whole thing down. Someone with a frozen shoulder, obviously there's less movement, but even in less graphic examples like that, where there's a little bit of pain, you might find someone who's guarding and not letting you move that. So the zone of what you're able to do with them, you know, we're talking about distance, but also ability to move things, shifts. And so what you're doing continually with osteopathy and craniosacral therapy and other hands-on treatment is that, or we should be doing, is we are trying to hone that zone, honing the zoning, so that we get that point where we're working with as much as we can, because more movement in those cases, or touch in certain cases, or maybe with our intent in other cases, you know, that the more we can do that, the more tools and the more, if you like, ability we have to change. Because if you can't touch someone, it obviously limits, doesn't stop, but limits how much you can do for them. So the more we can do, the better. So we want to go up to almost that edge of that zone and what we can do. But equally at the other end there, so if we take this zone, this is pushing up to the point where we're getting good treatment, but going beyond that is going to disconnect the treatment, it's going to annoy the patient, it's physically hurt them in some instances, emotionally disrupt them, emotionally upset them, all those kind of things. So that's the barrier there. The other end, that barrier, is when you drop off the other end, you're not doing anything. So let's say you've got the zone there, you drop off there, you're not touching them and you're not energetically engaged. Or you are touching them, but you've just withdrawn your intent so much that you're not doing anything. Or if the shoulder needs mobilizing, you're moving it in this range here, which is not mobilizing it, and you aren't doing some other treatment, like you're trying to rehabilitate the nervous system or get it to understand that, oh look, I work well in this range, and if I work well in that range, then you're integrating functional, teaching that shoulder that it can move properly, rehabilitating the nervous system. So there's lots of different aspects we can talk about this, but really what we're talking about is a zone, and that zone on one end, you're disconnecting because it's too much for the patient, emotionally and physically. On the other end, you haven't connected at all, you're not doing anything. It's like you're kind of just sitting there doing nothing, like you've never had any experience as a healer, any tuition of it at all. You're just a lay person in the public, hanging out and not even holding the space for the patient. And I'll give you an example of that in terms of intent. I was out a couple of days ago and I was talking to this lady. It was after an event, and I was talking to her, and she was telling me she was a healer and telling various different energy modalities that she'd worked in. And there's another, and I was explaining I was an osteopath. Another person came and joined us, and he heard us talking, and he said, you know, I've actually got quite a bad back. And this other lady said, you know, that can be really difficult, bad backs. And what I realized she was doing immediately, she was holding the space. Now, I think she knew what she was doing, but she was really holding that space for that other person. So she didn't touch them, didn't know them really until just met them, but naturally in that healer aspect of her, she reached out for that person and was helping that person. And that's an important story, because we're going to come back to that at the end of this video, because I'm going to talk about the healer's curse, which sounds very dramatic, and actually is quite dramatic. And if all of us that are in the healing profession have it to some extent or another, there's the blessing of being a healer, and there's the dark side, which is the curse, which if we don't understand that shadow side, it can really drain us and affect us, and we can get hollowed out, and literally like all of our goodness is just being sucked out of us and spread to other people, and not necessarily help them in the long term, but drain us out, we get burnt out, and we don't become a healer anymore. So we're going to talk about that later in the video. But to come back to this zone aspect here, so what can happen is, regardless of how much touch you're doing, how much intent you're doing, how much moving you're doing, you want to be in this zone. This zone where you're doing work, you're doing connection, you're not upsetting the patient, but equally you're not doing nothing at all. Now when we talk about It's about time I talked about high trauma babies or high trauma patients or patients with a large emotional load. What you have is this zone, suddenly this zone just collapses really rapidly. And so your ability here, instead of having a wide aspect to work with, where you can do lots of your techniques, and you're not being sloppy, but you have a wider path to work with, and you don't have to hone, you don't have to walk the tightrope as much as with some of the other patients. And you'll know that from experience, where you do one technique with a patient, it works, the next technique, well, why didn't that work with a patient? Now, sometimes it's because something else is needed, but often it's because you haven't honed in that zone enough. They need you to walk on this path for them, not out on this wide path where you're wandering along the yellow brick road. You're on this tightrope and you're walking. And sometimes you go off one end and you, okay, their system flares up a little bit. And they may tell you if they're an adult or if they're a baby, they might be cry or whatever. And so you've got to come back onto that tightrope. You go, oh, okay, that's too much. I've got to back off a little bit. But if you slip off the tightrope on the other end, you're not doing anything. That one's hard to spot because an adult will just lie there kind of like, okay, yeah. And you might have a whole treatment like that and they don't come back. Why? Because you're off the other end of the tightrope. You didn't do anything for them or enough for them. So we've got to walk this tightrope. And the more trauma the patient has, the more that tightrope is going to, that zone is going to close down and become this tightrope. So if that's the case, how do we actually deal with that? Well, going slowly, like this practitioner said, yes, that's one thing, and you can approach slowly in terms of, you know, trying to feel your way in. You might get the history, a little bit more of the history, a feel for that. But at the same time, if you just go slowly, that doesn't necessarily get you the connection. And often, if you go slowly, you'll end up dropping off that end of the zone where you're not doing as much, or you're doing a little bit and then not much, and then a little bit and then not much. And, you know, it can be many, many, many treatments before you get anywhere. And often patients won't come back. And so, yes, you want to go slow initially with your intent and the way you're taking the history, and you're kind of investigating, and you're not, you know, scaring the person too much or overwhelming them, but you're trying to draw them out and allow them to come to you so that you can feel how much, you know, zone you've got, how big a zone you've got, how fast you can go. And then you can start to pick up the pace a little bit. But also the trick is, what you're doing is you're holding the space for them, consciously holding the space. So what's happening when you're treating the adult, or if you're treating a baby, you're holding the space for the mum or the dad and the baby, is while you're taking that history, you're asking questions. And they're questions that you are wanting to know the answer for, you know, when do you get the pain, what happened with the birth, etc., etc. But you're not like asking the question and then asking the question and writing down. You see this with doctors and obviously other practitioners as well. You know, they're typing away the computer, and then what? Yeah, they're not really engaged with you. So yes, you need to record your notes, but more of those questions around allowing that person to draw them out and allow them to come out. Now with an adult, if they're not doing that, you get up and do the examination, you put your hands on and you start asking them about the body, because then you're, and I've talked about it in another video, you're focusing on the body, you're taking the problem away from you and them, and you're making it a third person where the two of you can focus on this problem that's in the body. They have somato-emotional issues, if they have trauma on the emotional side, that's very useful in terms of deflecting it away from that it's their fault, your fault, all those kind of things. So we're holding this space for this patient, this baby, this adult, and while we do that, that allows them to have more of a connection for us. And this is what I'm going to link back to the start of the video. So then they become more like that patient when they were in the treatment room with me, allowing them to touch them, and less like the patient in the reception room where they require a 6-foot distance away from you. Now that's even the case with adults that have coming in and voluntarily coming in for treatment. They're like, okay, I want you to treat me. With a baby, they haven't volunteered for that. Their parent has brought them in. So you're going to build that connection. What happens is, if you start to build that connection, they will start to change and the zone will widen. Now it might not widen this much, it might go from this kind of razor edge tightrope to like, you know, 1-inch tightrope. And it's particularly with those fetal alcohol syndrome babies, detox babies that have issues like that, babies with high trauma, then you're going to need to do that. Patients, adults with post-traumatic stress disorder, wow, that's like this razor blade that you go walk down. Well, of course, you're holding that space and opening up that a little bit, allowing them just to trust you a little bit to get that connection. The more you widen that up, the more that you can get in and do a little bit more, which widens it a little bit more. So that's one aspect of opening that zone up. But the other aspect of opening that zone up is that there are specific, how do I put this? You're looking for the source of the problem with this patient. Adult, baby, doesn't matter. You're looking for the source. Now, often it's like several sources. It's like 3 or 4, 5 or 6 or 7 or 8, 9 things all combined. But you're looking for the major ones. Is it in the somato-emotional field? Is it that their nervous system is fried? Is it literally, is their low back is just really painful. There's no somato-emotional involvement at all. They've got a really sore back and they can't work. That is stressing them majorly, because now it means they can't do stuff, they can't earn money, etc., etc., etc. Is it that baby can't latch and so they're not getting the nutrition? So there's going to be specific problems that you're trying to hone in on. And the reason I mention that is because when we talk about this zone and being in the right zone, that's a kind of, craniosacral therapy, energetics, kind of broad stroke approach that we might think. And so what happens is when you go into that broad stroke approach, yes, it's good and needed, but at the same time within that macro, you need to be micro. You need to be focused on, okay, well, what about X? What about Y? What about Z? Can I build a really solid picture or really solid experience? What's going on for this person that's in the room with me? And the closer you can do that, then the more that they're going to feel held, the more that they're going to open up that tightrope to become a little bit of a wider zone, which allows you to get more treatment, which means they say no less, and it means you get a little bit further, which widens it a little bit more and more and more and more. And so this is really the key when you're working with these high trauma babies. It's not necessarily to go slow all the way through. Go slow, build a connection, and then try to find these specific things, which might be asking about history. It might be with your hands on, just saying to the tissues, okay, I wonder how that was for you during birth. I wonder how you feel about being in this world. So if we can come in there and hold the space for that baby, it can start to happen. But the difficulty is the baby will go, no, not interested. And because it's not just about holding the space emotionally, sometimes physically you need to get on the right spot, the sacrum, or over the cardiac area, or over the neck, or over the head, or find a physical space, a place where, that's where if I can get a change, they're going to trust me. So as a healer, our job is to ethically find a way in so that we can connect to the patient and we can get that treatment moving. And with high trauma babies, high trauma adults, that's harder. And so we've got to look a little bit wider at our tool set and find the way in and find the way kind of through the maze to get the difference for that patient. And that segues beautifully on to the healer's curse, because I suspect you're already starting to maybe beat yourself up a little bit about what you're not doing as opposed to all the great work that you are doing. The healer contract is that we're helping someone else. And the healer curse, the dark side of that, is that we never feel complete because we never feel that we've healed enough people, or we haven't healed this person enough, or we haven't done enough for them. And of course there'll be all those success stories that you've got, and same as you, it's like, great, if I can focus on those success stories, great, that's wonderful, it makes me feel good. The last patient in, great, they were great. And then suddenly you treat 9 people in a row and you do great work for them. One of them in the day didn't. You go home worrying about that. Wow, maybe I should have done that differently. Why couldn't I fix that person? And there's a positive element in that. You should be thinking, what can I do better for them? But in a really disengaged way. In a way that's kind of almost theoretical. You're not emotionally attached to the fact that you didn't get as far as you want with that patient, because otherwise that's going to feed the beast. It's going to feed that healer's curse, where we'll always think we don't do well enough. And that load is increasing because we only have to look out in the world and the weight on the world is getting heavier. You see people, there's the amount of mental health, the mental depression, the mental anxiety, physical problems, chronic health problems, even though, what we can do in terms of health is better than it's been ever before in our life. We talk about MRI machines, PET scan, all the different scans we can do, all the amazing stuff they can do with antibiotics and medicine. So it's not saying, well, let's reject that. That's amazing stuff. That tends to sit in the realm of physics, and then the chemistry is more of that drug stuff. And yeah, we can do great stuff with that. But still, what's happening? There's more people unhappy. There's more people sick. And so there's not a video about that, so we won't talk about the whys and how we can fix that. But that is a bigger load. And so every patient that comes in is harder to fix than they were 2 years ago. They're harder to fix than they were 10 years ago. Harder to fix than they were 20 years ago. I can tell you that for sure from personal experience, but also talking to other osteopaths and practitioners going further back. They're harder to fix than they were 30, 40, 50 years ago. And so we're really important now, more than ever, that we look after our own health, our own mental health, and that you do as much as you can, and then you do no more. That's it. And you have to be comfortable with failure. There's going to be some patients that you aren't going to be able to fix, especially if you're drawn, which many of us are, to work with patients that are really difficult, really complex, have a high amount of trauma. Look, that is amazing work to do, so I don't say don't do it, but you've got to realize that you're going to not fix many of these people. You're not even going to help some of these people, but the point is you try, and that's all you can do, and then you do your best and leave the rest up to, we call it nature, God's will, whatever word, phrase you'd like to choose for that. Now, to wrap up this video, I've got one more thing to say. You can change these people's lives. You can change a baby's life for affect the whole of their life, from a little baby all the way up to an adult. They're going to grow up into a teenager, a parent, so it's just amazing the influence you can in the world. But that's not what I want to stress. Yes, you can change these people's lives, but they can change your life. Why? Because it's not just about the enjoyment of you being able to help someone that's really difficult and maybe other people couldn't help. That's more on the ego side. It's about the fact that they challenge you so much and they really shine a light on you and your issues. Let's say it's the healer's curse. Let's say it's some other aspect of your personality. It's going to shine a light on that and really spotlight that for you. Now, it might not be in a nice way. You might feel uncomfortable. You might feel challenged. You might feel, go home and you're angry or you're a little bit down or whatever. But if you look at those patients, they are shining a light on the cracks in your own personality. And those are the cracks we want to get in and look at and work with. I'm not saying necessarily psychoanalyze it. You can if you want to do that thing. But just be aware of that. Okay, that's interesting. Yeah, my own personal journey, when I first treated patients, boy, my ego, that was shocking. Now, I didn't go around say, oh, I'm awesome. But inside, I had that kind of whoa, what's going, and I had to move through that. It wasn't like an evil thing. You can have ego in terms of that respect, and you can enjoy what you do, and it can make you feel better. That's okay. But there's also a deeper aspect within that of understanding why you're drawn to do this work. And if you can go deeper with that, then it can really help you on your own journey. And if you have mental health issues, if you have any of that kind of stuff, and most of us do, then you start to work that through so it doesn't become an issue for you. And if you're blessed enough not to have any of that, well, it allows you still to deepen your character and to be a better person, which in the end is why we're here. Do feel free to comment if there's anything you want to say about this. It's a big topic. There's a lot more we could talk about it. If you just like the video, please hit the like button. And there's many more videos. You can see the playlist there for the adults and the babies. So do check those out. There's a lot of material there because I try to range across a big aspect of what we do and get into depth in these type of things. So hope this was of great use to you.